Today, we are going to demystify something that's super common and, let's be honest, pretty annoying: cold sores. We're going to cover what they are, what sets them off, and most importantly, what you can actually do about them. Let's dive right in.
You know that feeling, right? That little itch or tingle on your lip that just makes you go, oh no. It's that classic signal that an unwelcome visitor is about to show up, and that's exactly where our story starts.
So what exactly are we dealing with here? Let's go ahead and pull back the curtain on this very common mystery.
To put it simply, cold sores, which, by the way, you might also hear called fever blisters, are just these small blisters that pop up around your mouth area. They're caused by a virus, and yeah, while they're usually on the lips, sometimes they can show up near your nose or on your chin too.
Okay, to really get a handle on cold sores, we have to talk about the culprit behind them. Let's get into the virus itself and what exactly wakes it up.
So, the main cause is a virus called the herpes simplex virus, or HSV for short. Now, the vast majority of cold sores are caused by one specific type, which is known as HSV1.
Okay, now this is a really important point to clear up because there's a lot of confusion around it. You've probably also heard of HSV2, which is typically linked to genital herpes, and while it's true that HSV1 usually causes cold sores, it is absolutely crucial to know that either virus can technically cause sores in either location. And this virus, HSV1, is incredibly contagious. It spreads really easily through close contact. So we're talking about things like kissing, for sure, but also sharing stuff like forks, glasses, towels, or even lip balm. All of those can pass the virus from one person to another without you even realizing it.
And here is the really tricky part. Once you have the virus, it never really leaves your body. It actually travels to your nerve cells and just kind of hides out there. It basically goes dormant, like it's sleeping, just waiting for something to come along and wake it up. So what wakes it up? Well, a whole bunch of things we call triggers. Some of the biggest ones are stress and being really tired, but also getting too much sun, going through hormonal changes, or even just being sick with a cold or a fever. Any of that can be enough to trigger an outbreak.
Now, when the virus does wake up, the outbreak that follows tends to happen in a very predictable pattern. So let's walk through the 4 stages of this attack.
Okay, so first you get that tingle and itch. That's stage 1. Then, in stage 2, the little fluid-filled blisters start to form. Next comes the part nobody likes, the oozing and crusting stage. This is when the blisters burst, and it's also, and this is key, when you are the most contagious. And finally, you hit the home stretch, stage 4, when a scab forms and the healing begins, which, good news, usually doesn't leave a scar.
All right, now for the part I think we've all been waiting for. While there isn't a cure for the virus, you are definitely not defenseless. So let's build out your management toolkit.
So your options really fall into 3 main groups. First, there are prescription antiviral medications, which can help shorten an outbreak. Then, you've got your over-the-counter options, like creams that can help with the symptoms. And finally, there are simple home remedies, like a cold compress, which can at least give you some relief from the discomfort.
But honestly, the most powerful part of your defense is prevention. Things like protecting your lips from the sun with an SPF lip balm, that's huge. Obviously, avoiding close contact and sharing items when you have a sore is a must. And then, managing those triggers we talked about, like through meditation for stress, or just making sure you get enough sleep, that can make a massive difference.
All right, let's wrap this up with a quick debrief, answering some of the most common questions that people have about cold sores.
First up, the question that is on everyone's mind during an outbreak: how long is this thing going to stick around?
Typically, you can expect a cold sore to be completely healed within about 1 to 2 weeks. Now, that timeline can vary a little bit from person to person, depending on your immune system and whether or not you use any treatments.
And the classic follow-up question, if it goes away, why on earth does it keep coming back?
It all goes back to that dormant virus we talked about. Because the herpes simplex virus stays in your nerve cells for life, it can pretty much be reactivated anytime it runs into one of its triggers.
Here's a really interesting one. Can what you eat actually have an impact on a cold sore outbreak?
So there's a fascinating theory about this, and it has to do with 2 amino acids. Some research suggests that an amino acid called arginine, which you find in foods like nuts and chocolate, might help the virus replicate. On the flip side, another amino acid, lysine, found in things like fish, chicken, and yogurt, might help suppress it. Pretty interesting stuff.
Okay, this is a super common point of confusion. Are cold sores and canker sores just 2 different names for the exact same thing? Nope, absolutely not. And the key difference is all about location, location, location. Cold sores are viral, and they pop up on the outside of the mouth. Canker sores, on the other hand, show up inside the mouth, on your gums or cheek, and they aren't caused by the herpes virus at all.
So, we've covered the what, the why, and the how of it all. The only question left is for you. Now that you're armed with all this knowledge, what's one small habit you think you could change to help manage your triggers and keep that virus sleeping? Thanks so much for joining me.